Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, big changes loom in healthcare. Our expert, Dr. Stuart Shapiro, will update us, and then an exclusive interview with John Hanger, who just left as Pennsylvania's Secretary of Environmental Protection. That and more when Pennsylvania Newsmakers returns.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back. Well, the host might be losing it. I was supposed to say Pennsylvania politics and government in depth and in detail, and it all starts right now. It does all start right now, and sitting across from me is one of the experts we call in, Dr. Stuart Shapiro. He's the president and CEO of the Pennsylvania Healthcare Association. All right, look, states are facing huge challenges with health care. In all sorts of health care programs, nowhere more do they face a challenge than in Medicaid, which is, what, 20% of Pennsylvania's budget. And if that isn't fixed, if that isn't worked out, this is a huge problem coming up during the course of the budget debate for next year's Pennsylvania budget. Talk about the problems that you find with Medicaid and Medicaid spending.
Sure. Medicaid today is 22% of the state budget. The federal government, just starting this coming July, is going to cut back on the federal matching. So there's a budget hole. And there, frankly, are no simple solutions. Someone's going to say, why don't you just cut eligibility and take people off the welfare rolls? Right. You could work with that a little bit, but there are some federal rules around that. So that's not a simple solution. Right. Someone else is going to say, just cut the dollars you pay to all the providers, hospitals, doctors, nursing homes. That's not going to work either.
Won't that just raise everybody else's cost of health care?
Well, yes and no. What it will do, right now, hospitals and doctors and nursing homes are all underpaid under Medicaid. Right. And they make that, they're able to care for those people because they get extra reimbursement from Medicare, from private insurance. Right. And hospitals are easily, or relatively easier than nursing homes or doctors, to shift the payments from ship the dollars into Medicare and into those other payers. For nursing homes, where 65% of the patients or the residents are covered by Medicaid, you right. can't make that up.
You can't make it up.
And what Governor Rendell did is he so expanded non-mandated services that he stopped paying adequately and paying for good quality care for those mandated services.
Give me an example of a couple of non-mandated ones. We've talked. Other
Sure.
folks have come on.
He's
and talked
expanded
about
dental services, which are good services, but they're not mandated under the federal program. He's
right.
expanded some chiropractic services. He's expanded enormous good services in the home health care arena, but these are not mandated. And what the net effect has been is that the nursing homes, which depend on Medicaid, are now being faced with a frayed safety net. They lose currently, or they get under-reimbursed, $15 a day. They're under-reimbursed $5,500 a year taking care of Medicaid people. And with the Medicare cuts that came along with health care reform at the federal level, the availability of quality nursing home care is now going to be placed in serious jeopardy. And the Corbett administration, which is already filled, and they're adding more every day, very smart people, are now looking at how they can assure that that safety net is put back together, and that cuts are not made across the board, but are selectively made to make sure that the elderly in Pennsylvania continue to receive the care they need.
Now, does that mean that some of these non-mandatory services will be reduced or eliminated? I mean, is that, I realize you're not going to make up for the loss of $2 billion the state that will come to the state after, when the change in the formula goes through, Medicaid, payments to our state. But you can't get it out of just eliminating some of these sort of optional.
That's only part of the solution. And clearly the Corbett folks are, and I don't obviously speak for them.
Sure, of course.
But starting to eliminate non-mandated services, or certainly stop their growth, can result in millions and millions of additional dollars to to put back in to keep a safety net from falling apart. There's a whole bunch of other ways that we can begin to address the inequities in Medicaid. But it's real important that the...
Go ahead. No. I want to pick up on just what you said. So, but what you're saying basically is, given the situation with the federal government, with the $14.3 trillion national big debt and long-term debt and the $1.5 trillion annual deficit this year, you don't expect any help from the federal government, do you?
Oh, I don't think we'll. I think we've got to find our own solutions in Pennsylvania. And the way I begin to think about it is, let's go back to basics. Let's make sure that those people who need services get quality services.
Right.
Back to basics.
Right.
Not expansion of mandated services.
And now does this decision, do you think, have to be made as the Corbett administration approaches this new budget? His first budget is on everybody's mind. March 8th, the governor will deliver his budget message. I don't remember an anticipated budget message in modern times quite like this one. Do you think that he has to deal with this because, as you point out, 22% of the budget, right?
Well, there's a lot of things he needs to do, but he has to address some of the problems that exist in Medicaid.
Okay.
And he certainly has to focus on eliminating any fraud. He certainly has to make sure that payment system...
Not easy to do.
But it can be done.
I understand.
The low-lying fat has already been removed. But there's still work that can be done, and Tom Corbett has experience with that. These are smart people.
Yep.
But the goal is to get back to basics.
All right, we're going to take a break. When we come back, one of the other topics that is big on the Attorney General, the new governor's agenda, is lawsuit abuse, and the bill was passed to deal with that. The governor vetoed it. I want to get into that with Dr. Shapiro. It's an important topic. All right, health care, it looms as a huge issue. It continues to be one, and we're going to cover it routinely on this show. Back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. Talking, what are we talking about? Healthcare reform. What else would we be talking about on this show with Dr. Stuart Shapiro from the Pennsylvania Healthcare Association? All right. Governor Corbett, throughout the course of the campaign, said, yes, I'm in favor of lawsuit abuse reform. Point number two, Doctor, Governor Rendell said he was for it, but then vetoed a bill. First of all, talk to me about what you think lawsuit abuse has to accomplish.
Well, first of all, Pennsylvania, according to a Harris Interactive study, is in the lower half in the United States of being a climate that's fair to citizens and fair to business in terms of lawsuits. Pennsylvania has so many frivolous lawsuits, and it's cost our businesses a lot of money. We need to stay competitive. And if you look at Delaware, they have a great lawsuit system. They're ranked #1, and they're right next door, and they're stealing our businesses because people would rather operate there.
Right.
Secondly, we need something that allows people to get fair settlements when something untoward happens, but we don't need the lawsuit abuse that currently exists. There's several pieces of legislation that are being introduced that have broad-based support. Mm-hmm. Governor Corbett has supported them. Governor Corbett spoke about it during his campaign. The House, the Republican or the House of Representatives in Pennsylvania appears to be supportive of this.
Right.
They've passed some of this legislation in the past, and Governor Rendell vetoed it.
What are a couple of the big elements?
The first element is something called the Fair Share Act, which says that if in a lawsuit, if you apportion who's at fault, and then you ask them to pay their share of the damages. And that is what the Fair Share Act would do. Under current law, what's in effect now, if someone is 1% responsible but happens to have a deep pocket,
right,
what the lawyers do is they go after that 1% and ask them to pay the whole 100%.
Right.
And that is very, very, not only is it unfair, but it's anti-competitive. In the healthcare area, we're one of a handful of states that don't have something that is called apology legislation. And that's real simple. A doctor, a nurse, hospital administrator, if something untoward happens in the hospital,
yeah,
whether it's done by error or just something, it's just unfortunate, they want to be able to go up to a patient and say, this is what happened,
right,
this is why it happened, we feel badly about it. And
now they're worried about doing this because if
they don't
it's
do
like
it
an
now.
Admission of guilt, right?
Right. They not only they run, and unfortunately, hospitals and doctors are trained to not admit even a potential error for fear it'll get introduced in court. So this would now allow people to have a good discussion. It's all the surrounding states have this. We're, as I say, one of a handful of states that don't allow this.
There's another aspect of this, and that has to do with punitive damages. That's pretty important. I mean, we're not now talking about the actual damage, meaning that, you know, if somebody, you know, has a problem in health care and they need additional medical care, they would get that medical care. If they lose some income, they would get that loss of income. But there's this aspect called punitive damages that is also a problem, yes or no?
Absolutely.
Explain that.
You take a city like Philadelphia, and it's been rated the lawsuit hell of the United States because of some of the punitive damage awards. You need some caps on that.
Right.
And I think over time they will be put on. And the way some of the laws are written now, there's punitive damages limitations over how many times it can be greater than compensatory damages.
Right.
And some of the federal courts have said there ought to be a relationship.
Yeah.
They shouldn't be just wild punitive damage awards that have no relationship to real damages.
Right.
And so there's going to be legislation, I would suspect, introduced that's going to put some caps on that across our entire business community.
All right, we're out of time. I wanted to get a little bit, maybe you'll come back and we can sort of talk about what's going on at the national government with Medicare and Medicaid, huge programs that are, you know, just looming out there with, I've seen numbers, $45, $50 trillion, you know, over the long term. The cost of these programs as the baby boomers, you know, get eligible, and as, you know, given the recession, the number of people collecting Medicare, hopefully you'll come back, and I'd like to get into that at some point with you. Thanks a lot. All right, coming up, our interview with John Hanger. He just left as Pennsylvania Secretary of Environmental Protection. Would Marcellus Shale be on the agenda? You'll see.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, joining me, as often is the case, is John Hanger. He left as the Secretary of Environmental Protection. He was a PUC commissioner. You were head of Penn. Is there anything you haven't done, Secretary Hanger?
Well,
you've got broad experiences, right?
I do. I've had a great career, and I'm looking forward to the next stage.
Yeah, well, we'll have to have you back sometime. You can talk to us about what you're up to. All right, look, it wouldn't be our show. You couldn't have a show right now and not talk about Marcellus Shale. I think you would agree. And it's, you know, it's controversial. You know, you got this big industry. It's obviously going to employ thousands and thousands of people. Most of the attention has been on this tax, severance tax. I want to get to that, but I also want to talk, I mean, you're the expert on this. And let's go through it. Some of the concern has to do with this process called fracking, well drilling that, does produce contamination in the runoff. How safe in general are Pennsylvania's waterways from fracking?
Well, all of the water that is used to deliver drinking water is completely safe. It meets the Safe Drinking Water Act.
Okay.
It's monitored and tested daily. If there is any reason for the water not to meet the Safe Drinking Water Act, at least when I was at the department, we immediately put out a drinking water advisory.
Right.
And that is an issue that just cannot have any compromise about. Our drinking water must meet the Safe Drinking Water standard.
Hopefully no one would disagree with that, but
I
go
hope
ahead.
So. And there are many threats to our drinking water, and they don't all come from gas drilling.
Yeah.
There's industrial threats, there's coal mining threats, there's even some ag runoff. There's what people, frankly, throw down their sewer, and it works its way into our waterways.
Absolutely.
So we all have a reason to pay
Including
attention.
waste products from the Susquehanna River, and that get into the Susquehanna River and end up in the Chesapeake Bay.
Antibiotics, all kinds of stuff. And we all have a stake in cleaning that up. But right now, our water is safe to drink. Now, it's absolutely vital that the Department of Environmental Protection be the environmental cop on the beat.
That's where I was going with my next question. Do you think, as staff now, the Department of Environmental Protection has enough field reps, I don't know what you would exactly call them?
Sure, inspectors and others.
To take care of this tremendous expansion that is going on?
Well, in 2008, we did not. We had 88 people in the DEP gas oversight staff, but we more than doubled the staff. And so as of January 2011, we have now 202 people in the DEP gas oversight staff. We're the only state in the union that doubled it. Now, the staffing is crucial, and as the gas industry grows, that staff needs to grow. So that is a management decision that should happen every year.
Well, right now, what do you have? Half of them in Bradford County? Where I understand, is that where the most of the... I read a statistic, you'll correct me, you're the expert. 25% of the drilling for natural gas is in Bradford County?
Well, Bradford County is a hot spot, but there's Tioga, Susquehanna, Washington County, and others.
And it will expand.
Yeah, and we've opened 2 new DEP oversight offices because the gas drilling has expanded across the Commonwealth. Mm-hmm. You can't do gas drilling without any environmental impact. Right. Even when it's done well, there is some environmental impact. And when it's done not well, the impacts increase. But we also have to remember, if we're not going to use gas, we're going to use more coal and oil. And coal mining is a very dangerous business. It causes a lot of environmental damage. By the way, Terry, I'm very proud of the fact that in 2010, it was the first year in the history of Pennsylvania that we had no mining deaths in the Commonwealth. I'm very proud of that because DEP regulates the safety in the coal mines. But if we're not going to use gas, we're going to use more coal and oil in the short run. We are increasing solar and wind and biogas and the renewables, and we need to do more of that. Pennsylvania now is actually #2 in solar jobs in the country. Right. We're a top 5 state in energy conservation. We need to do more of that. But for the next 5 to 10 years, there's a choice that is really, unfortunately, comes down to gas, coal, or oil.
All right, we're going to run to a break. I'm chatting with John Hanger. He was Secretary of Environmental Resources under Governor Rendell. When we come back, I want to. It wouldn't be a program on Marcellus Shale if we didn't get into the severance tax in the local government community, something that I know you know a lot about. Sure. All right, we'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Welcome back to the program. I'm chatting with John Hanger. He was the Secretary of Environmental Protection. Obviously, Marcellus Shale is the topic for today. All right. I mean, here we go. Tax or not to tax. The new governor said no tax. The business community has said, the natural gas communities even said that, it wouldn't surprise them if they got a tax of some kind. So talk about the whole business of a tax I think you're in favor of one, correct?
Yes, I'm
Go ahead.
strongly in favor
Tell
of
me
it.
about why
And
you think we should have one.
I think the gas drilling industry is split. There are actually some companies that want the tax question settled to create certainty.
Yep.
They probably want it settled at a very low number.
Sure.
Fair enough. But they understand that Pennsylvania right now is the only state in the entire country without a drilling tax. Governor Perry in Texas has a drilling tax.
Yeah.
Governor Jindal in Louisiana has a drilling tax. Sarah Palin had a drilling tax and raised it in Alaska.
Yeah.
Governor Corbett actually right now is the only governor in the entire country opposed to a drilling tax. It's a position that makes no sense. We need a reasonable tax. Our neighbors have a drilling tax. West Virginia, they've had a drilling tax in place. I personally believe that the drilling tax should not be higher than West Virginia. But
competitive.
It should be competitive.
Yeah.
But we need to do that because we have big environmental needs that can be, in fact, improved by the revenues from a drilling
You got
tax.
environmental needs, but just recently, folks from represent local governments have testified before, I think, the state Senate, where they talked about certain problems, infrastructure problems, all kinds of other needs that get created by virtue. They want the jobs, but they also think some money needs to come to local governments to help them with their problems.
I believe in a 1/3 of the revenue should go to the local communities, 1/3 should go for environmental improvement programs like Growing Greener, and 1/3 should go to the general fund. This is a great opportunity for the state. This is a golden goose. We're not going to kill the golden goose with a drilling tax. No state has killed their golden goose with a drilling tax. And I think we should understand how strong, comparatively speaking, Pennsylvania's economy is right now. We're number 2 in the entire country in jobs created in 2010.
Right.
65,000 jobs were created in Pennsylvania in 2010. Only Texas created more jobs than Pennsylvania, and it's because we have an energy boom. It's the gas drilling, yes, but it's also the solar industry, the wind industry, and we across the board are strong in energy.
And it's also taking place in some communities where, you know, there have been brain drain, where young folks have gotten, you know, graduate from high school or college and leave because there aren't any jobs, particularly in the rural parts, some of the counties that you mentioned. That
It's been a godsend for some farmers and some local communities and some folks coming out of high school or perhaps college, and they've got a good paying job. We need to do the drilling in a way that is highly regulated, properly regulated. We need a reasonable tax on it, and then actually this can be a good thing for the state.
Yeah.
And if we use gas instead of burning coal at very old coal plants that are highly polluting, we actually can help clean up our environment.
Okay. All right, thanks for coming in. All right, that's it. We'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.